Medicolegal Issues in Obstetrics and Gynecology, Chapter 20, page 244. So why obstetricians are more vulnerable towards litigation? There are a few points to it. The first is obstetricians, they deal with two lives at the same time. One is the mother who is pregnant and her developing fetus. Okay. Out of which one is seen clinically, that is the mother, to see the symptoms, etc., to predict that if she's in the high risk category or not, if the physiology is normal, her well-being. Okay. And second is the fetus, depending on the gadgets like CTS, Doppler, ultrasound, etc. Based on these gadgets, the fetus health will be monitored as well. Okay. So some fetal-maternal disorders are very difficult to diagnose at the right time because of the limitations of the advanced technology. How much ever advanced they may be, there could be certain limitations to understand the fetal disorders because of what is not born, what is not in front of you. To understand the disorder, it is difficult. Okay, so some litigations and some lawsuits can arise from there. Okay, next is follow-up last for 46 weeks, that is the pregnancy. Along with pregnancy, 6 weeks of puerperium, in which the mother's postpartum phase is included. Okay, 40 weeks is of gestation, but the remaining 6 weeks is the mother's recovery. Okay, so because within that 1.5 months, there is a lot of change that takes place in a woman's body soon after her delivery. It could be pathological as well. Okay, it could lead to poor outcome, maternal deaths. Okay, so the follow-up is also included because it's a pretty long time. 46 weeks, it's a pretty long time. Okay, almost 10 months or more. So definitely the obstetricians are more involved with each patient since these long weeks. There are high chances of some litigations and lawsuits. Pregnancy and childbirth are perceived as a physiological process. Okay, every woman has to undergo through this at an average, generally speaking. Okay, so that is what the patient, the relatives, okay, they are mentally prepared for this to be a physiological condition. They are not expecting any bad outcome. Okay, so that is one gray area because of which obstetricians are at higher risk. Then obstetric patients are relatively considered young and healthy because there is a reproductive age. And in that particular reproductive age, women usually don't suffer from any lifestyle diseases as compared to men. Okay, after 30s, 35s and all, men do suffer from a lot of hypertension, cholesterol related issues, but women, until they hit their menopause, they have a protection against cardiovascular diseases. So they are considered young and relatively free from any disease conditions. Okay, so if any mishaps happen and there is a child at stake, mother at stake, so there is an emotional attachment. Okay, so the mental and physiological distress of the patient party and relatives is very high during these events. Okay, so they may go for certain lawsuits or litigations as well. So these are the reasons why obstetricians are at higher risk for litigations. Then duties of an obstetrician. The first duty of the obstetrician is towards the mother and the unborn child. Okay, to take good care of them during the antenatal period as well as during delivery and in postpartum. Okay, so good care has to be given to the mother as to also to the unborn child. That is the first duty. And also keep the patient and the patient party, everyone informed about what is the progress of the situation, progress of the labor, progress of the antenatal period. Okay, time to time progress has to be informed to everyone so that no sudden attack should be there at the end, no breaking bad news, sudden shocking news at the end. Okay, every progress step by step has to be informed to the patient as well as to the patient party during the antenatal period towards the patient. During the labor, patient party has to be involved. So an obstetrician can also if they are breaking their duty or bond, for example, if an obstetrician's patient is admitted with labor pains at midnight and if the doctor is called, she has to be present. Okay, if she does not, if it was in a situation where there was a harm to the doctor, then he or she can not attend the situation. But in any other way or form, the doctor has to be present. The obstetrician has to be present during the time of labor and delivery. Otherwise, the patient may feel that I have spent so many weeks with this particular obstetrician, and at the time of labor, they were not present. And this enough for them to feel like they have been cheated, and they can go to the court and sue the doctor. Okay. And high alternative management options, if at all it is present, it has to be informed beforehand. Okay, any referrals if this is a high risk pregnancy which cannot be tackled by the concerned obstetrician, any a better experienced or a referral is required, you have to do the referral services. You have to carry forward the referral services. Attend the patients, all the queries of the patients and the relatives should be addressed properly. Even if the patient has been booked for labor at odd times like midnight and all, the doctor has to attend the patient. Otherwise, it will lead to a breach in the obstetrician and patient relationship. High risk areas, high risk pregnancies have higher chance of litigations. Okay, so make sure that you have a very good documentation and counseling given to the patient who come under the high risk category. Areas of suits, which are the areas usually litigations and lawsuits take place in obstetrics and gynecology. Obstetrical suits, first we will discuss about the obstetrical part. Antenatal care for high risk pregnancy, errors of omission in antenatal clinical screening and diagnosis, any errors in diagnosis, errors in omission of ultrasonographic screening or diagnosis. A day it was fixed for USG, but it was not done at all. Okay, because any genetic conditions or any genetic disorders we are able to detect and diagnose them because of these screening systems. If it is omitted and if the child is born with certain genetic condition which could have been detected earlier, it means that it's an error on the hospital or the doctor's side. Preterm labor, maternal injuries during delivery, vaginal delivery, instrumental delivery, any maternal injuries takes place, episiotomy and perineal tears without informed consent, instrumental delivery without informed or proper disclosure, because as soon as you have to move forward for instrumental delivery, you have to inform the patient party. Okay, perinatal death during IUFT or neonatal deaths, etc., birth asphyxia, neurologically impaired infant because of birth complications, postpartum hemorrhage. Okay, swab retained after the procedure in the uterus. Okay, these things can lead to obstetrical suits. Gynecological suits, common areas, removal of ovaries without informing the patient, sterilization, contraception failure, okay, incomplete medical termination of pregnancy. Some part of the fetus is remained in the uterus, it could lead to infection. Okay, so that is incomplete medical termination of pregnancy. Perforation during medical termination of pregnancy, you hit any healthy tissues, it leads to injury. Undiagnosed extrauterine pregnancy, like ectopic pregnancies that takes place outside the uterus. Okay, and if it is not informed to the patient, that could lead to lawsuits. Retained swab or foreign body after surgery, injuries to the abdominal structures after surgery, delay in diagnosis or malignancy, delay in diagnosing cancers, wrong diagnosis of malignancy. If the patient is not having cancer, but you diagnose them as a cancer patient, incomplete surgery done for malignancy, these all are the areas where gynecologists can be sued. Then certain litigation area, more common area where a lot of litigations go on. Missed ectopic pregnancy. Ectopic pregnancy was present, but it was not informed. Twin gestation, placenta previa, congenital abnormalities like dwarfism, hypoplastic left heart, neural tube defects like left lip, spina bifida, Okay, intrauterine growth retardation. These things, if it is missed, it is not informed to the patient or patient party, it would be a litigation. Failure to act on normal or suspicious USG findings, failure to give proper advice. Okay, these are the areas where some cases can go on. Then battery, most of the, it's a very common area. Battery, it means that you are touching the body of the of a concerned client without their consent. Okay, offensive body contact without consent. That is what battery means. Okay, in cases of surgery, this legal burden will directly fall on the practitioner to prove that informed consent was taken. You did touch the body with informed consent. Okay, so because before every surgery, informed consent is taken, which automatically claims that the practitioner is supposed to touch the body of the patient. Okay, so even in gynecology and obstetrics, you assess the patient. Okay, their perineal areas, their body. Okay, you are supposed to assess the patient on all these areas. But if the patient was in some other mental situation and they perceive that they have not consented, but still the doctor touched them inappropriately, that could lead to some litigations. Errors in antenatal screening and diagnosis, and which can lead to claims of wrongful birth. Okay, wrongful birth, it is given against the clinician for the birth opposed to the specific birth injury, because usually when the patients after birth of an infant with serious disfiguring disabilities like hydrocephaly, meningomycele, and encephalocele, these are the situations in which a child is born with a disfiguring disability. Okay, trisomy 21, that is Down syndrome. Okay, in all these situations, what the parents will usually do, they say that this genetic and hereditary condition is potentially a serious condition which was not recognized by the obstetrician during the diagnosis or during ultrasonography scan and testing done. They didn't recognize it, and because of which the child was given birth. Now the burden is on the parents to take care of the child who may be having some defects. Okay, so that is one area of wrongful birth. Wrongful life is an action claiming that the because of negligent prenatal testing, PNDT, okay, on the part of the healthcare provider, it resulted in a birth of a damaged child. The damaged is in inverted commas. It means that the child who may be suffering from some serious defects, birth defects, okay, physically or mentally disabled child, they call because of and it is not the fault of the patients, but it is the fault of the practitioners. They didn't inform the patients, otherwise they could have gone through the medical termination of pregnancy. Okay, so such claims usually involve a devastated infants with serious genetic disorders and undiagnosed maternal disease or early pregnancy, drug exposure, etc. These could lead to a seriously defected child. In the legal terms, it is said that it is the duty of the clinician, and the clinician has a duty towards the unborn child, as well as they have a duty towards the parents as well. Okay, if the unborn child has some serious disfigurement or any mental or physical disability, parents have to be informed. Then it is their choice to continue the pregnancy or not to. Wrongful conception, it means that parents who are practicing any family planning techniques, like if they have undergone some surgical family planning techniques and even after that they conceived, okay, they have done sterilization operation, etc., but still after that they conceived, it means that the sterilization operation was not done properly, or the copper T, even after putting copper T, if a woman is conceiving, okay, she can also go and sue the doctor that even after using this birth control technique, they have still conceived. Okay, so it's a common problem in women who become pregnant following a tubal ligation procedure, in which ovum can still go into the tube and it can get fertilized. Okay, so These are the areas where which wrongful conceptions can lead to court cases or lawsuits. And even for men as well as for women, after any ligative surgery, if they are conceiving, okay, it has to be looked properly. Okay. Then wrongful death. Wrongful death is a cause of action arising when otherwise a normal pregnancy which had reached viability, okay, it was terminated just because of misdiagnosis. For example, any renal agenesis resulting in pregnancy termination. Okay, at the pregnancy was completely viable to the end. It was about to reach labor, but because of renal agenesis, the pregnancy had to be terminated. Okay, so these are the areas in which a death was not planned, but it took place. Okay, because some conditions are there in the child who is being conceived. They have some knuckle translucency, for example, neck stiffness. Okay, if this kind of screening is done, it is understood that the most patient should be offered with an opportunity for first trimester screening, because MTP can be done only in the first trimester. Okay, and if the physician is failing to offer this first trimester screening to the patients, that could lead to a risk of lawsuit. It's the obstetrician's duty to inform the patients that within the first 3 months of the pregnancy, you have to undergo this screening. If you do not undergo this screening, you will not able to be diagnosing certain genetic disorders, okay, or any disease conditions in the unborn child. Okay, so to prevent such conditions, better to go for a first trimester screening. This is the duty of the obstetrician to inform to their clients, and then they will make the clients will make the decision to go with the screening or not. Then we have ectopic pregnancy. New non-tubal ectopic pregnancy is in which pregnancies take place somewhere outside the uterus, but not in the fallopian tube. And there are tubal ectopic pregnancy, in which pregnancy takes place in the fallopian tube. Okay, so if if ectopic pregnancy is present, and if it is not informed, if there is a delay in diagnosis to inform the patient party, it could lead to rupture of the tube, which could lead to infertility in the woman later on. So it is always important to see that where the pregnancy has taken place. Is it within the uterus or is it outside the uterus? And accordingly, if it is ectopic pregnancy, there is no other way than to undergo the MTP, okay, because the mother's life could be at risk. Then premature baby, problems and diagnosis and management of preterm labor gives grounds for lawsuit because of high incidence of complications in preterm infants. Even when they are in NICU, the complication level is quite high when it comes to preterm infants. It is very difficult to keep them viable. Okay, 6-month-old baby or 7-month-old baby, it is very difficult. As the causes of many cases of preterm labor cannot be established, new tests like fetal fibronectin can help identify the population who is at risk of preterm labor. Usually teenage pregnancies, malnourished mothers, okay, underweight mothers, they all are at the risk of preterm labor. Also, certain vitamin deficiencies could also lead to preterm labor. High-risk obstetric cases. So all the high-risk pregnancies, there are a list of high-risk pregnancies, and even women who are of very short stature, less than 5'2" in height, or obese women who have obesity or overweight issues, gestational diabetes, okay, hypertension, women who are about 35 years of age and all, okay, so they all come under the category of high risk obstetric cases. Okay, so in that, antenatal fetal surveillance has to be done, fetal heart rate monitoring has to be done, ultrasonography surveillance, amniotic fluid index, biophysical profile study, color Doppler study. These all diagnosis has to be done to make sure to rule out any complications in birth on the child as well. Okay. If there is any deviation from these norms, it could lead to bad decision making, poor judgment, poor outcome of the pregnancy, and it would lead the doctor to the court as well. So to avoid that, all high risk pregnancies, make sure you take the advantage of the maximum diagnostic techniques available. The medical disorder in pregnancy, for example, any woman who is suffering from GD, gestational diabetes, PIH, eclampsia, preeclampsia. Okay, these all are the areas in which proper drug selection has to be done, dose selection has to be done. Medical management is very different from a non-pregnant woman. The kind of medical management you give to a non-pregnant woman is completely different from the medical management you will give to a pregnant woman. Okay, if she even if the pregnant woman, if she is suffering from AIDS or any other communicable diseases, the kind of antibiotics given, that the kind of therapy given is completely different from what you can give to an adult non-pregnant woman. So that has to be kept in mind, because certain medications can interfere with the placental exchange and it can affect the unborn child as well. Cesarean section. Cases related to cesarean section can face a lot of lawsuit, because if it was not performed in the correct way, if it was performed with delay, okay, and the obstetricians were trying to get the baby through vaginal delivery, okay, by allowing more time to it, and then making the last minute decision, that could lead to some scar rupture, cord prolapse, placenta previa, or anything. These kind of situations will further complicate the pregnancy. Okay, so timely decision to move to cesarean section is important, just to get the child as soon as possible through vaginal delivery, and avoiding the C-section could lead to the obstetrician to lawsuits. Vaginal birth after cesarean, that is VPAC. It requires proper documented discussion, risk and benefits of this with patients who have signed their consent. Okay, and this cannot be offered when the problems may be arising, like it's a complication. In that situation, this cannot be offered. If the patient or the relative, they insist for vaginal delivery, then you can put down their wish on paper and take their signature with the explanation that the full risk is on the mother and the baby, not on the physician. If they refuse to give a written consent, they can be referred with the findings on paper and the reason for referral to another hospital. Okay. Then IUFDs, or stillbirth, intrauterine fetal death. Okay, IUFD stands for intrauterine fetal death or stillbirth. Okay, this area is also have a high potential of medico-legal suits on the obstetrician. Past and present medical history with previous antinatal records should be used during the physician's defense in such cases. For such cases, you have to be prepared for with a list of non-preventable etiology of stillbirth. Okay, so in which areas this stillbirth could have been prevented. Okay, at whatever you have done to save the life of the child, but every measures were exhausted. You have to be prepared with such information. Okay, everything possible from your side you have done, but still this stillbirth was not preventable. Okay, you have to prove that in the court. Imaging and obstetrics and gynecology. Imaging in the sense all the radiographic techniques used, like USG, misdiagnosis, fetal anomalies, etc. They are the most common reason for obstetrical suits. So the best approach here is to get as much as imaging done, as much as scan done in the first trimester itself. Okay, by properly trained and qualified ultrasonologist and a well-maintained equipment should also be used for this diagnosis. If there is any doubt or confusion or any need for major decision making, second opinion has to be done. Don't just depend on one particular sonogram and then make decision. If you are confused, if a major decision is required, go for another round for screening or imaging, and then you can take the decision. Laparoscopic procedures such as problems like air embolism, okay, uterine perforation, hysteroscopy, infection. These are usually associated with laparoscopic procedures, which could have been prevented if a properly skilled staff and a proper sterilized equipment has been used. These situations could have been prevented. Then MTP, that is medical termination of pregnancy. We have an MTP Act of 1971. Okay, so if MTP Act is not followed properly by the practitioner, it could land them up in some legal troubles as well. So the main area of legal concerns in abortions or MTP is if there is an absence of guardian or parents in case of a minor or an unmarried child. Just give me one minute. So certain legal concerns which come under MTP, there should be a presence of a guardian in case if it is a minor or an unmarried woman. Though law does not require the consent of the guardian in the woman who is above 18 years, but if it's a minor, guardian's consent is important. Documented uninformed consent in poor format is not taken up in many cases. Many times doctors are not authorized to, as per Act, to perform the MTP, but if they still go through that, they can be considered as quack, and it could lead to legal situations. If MTP is performed without proper counseling or record keeping, that could lead in other troubles as well. Hospital or institution is not submitting regular or monthly reports to the authorities, that could also lead to legal issues. Termination of a fetus who is more than 20 weeks of gestation is illegal as per MTP Act, but I guess you can correct me if I'm wrong. I guess now they have done the amendment. Now it is up to 23 weeks. Okay, just make sure if it is that is the correct information or not. In the textbook, they have given 20 weeks, but in the recent amendments of this year or previous year, they have increased the weeks a little bit more. I guess it is up to 23 or 24 weeks, something like that. So you please cross-check that information as well. Proper documentation of second opinion of another qualified practitioner is important when the pregnancy is over 12 weeks or up to 20 weeks. If that is the age of the gestation, then a second opinion is required from the same qualified practitioner. Otherwise, if the pregnancy is less than 12 weeks, a single practitioner can make the judgment. In some rare cases, if the pregnancy is continued even after MTP, that could lead to legal actions as well. Incomplete termination of pregnancy could lead to infection, hemorrhage, and if it is not treated or attended properly, it could lead to legal suits. Then sterilization. A failure of the procedure of sterilization could lead to conception, and if it leads to conception, it's a wrong conception case, which we have discussed earlier. So if the client is already pregnant at the time of procedure, okay, or during the luteal phase, when the proper selection of a case cannot be done, so during the luteal phase of the menstrual situation or pregnancy, most of the sterilization procedures are not done, okay. And pregnancy occurring due to tuboperitoneal fistula, that is ectopic pregnancy, okay. In that case also, sterilization, that is a failure of sterilization. Spontaneous recanalization of the tube without any external effect, the tube's ligations open up and the tube can automatically form the canal all over again, okay, without any external guidance. So that is spontaneous recanalization of tube. Improper or incomplete or partial applications of rings over the tube, causing to partial occlusion, and that could lead to conception. If the rings which are used to ligate the tube after the fallopian tubes during sterilization, if it is not properly placed, that could lead to escape of sperms into the canal, and that could lead to pregnancy. Auto breakage of the rings due to poor quality, that can also be sued in the court. Wrong structure of the rings because of faulty identification. So these are the areas in which sterilization, some mishaps in sterilization could lead to legal troubles. So next is the important area of role of counseling, okay, role of counseling which the gynecologist or the obstetrician has to give to various age groups, various situations. For adolescents, teenagers, brief knowledge about the physiological process may be necessary for this age group, with a sympathetic attitude, because the adolescents usually have to be taken into consideration with a very good words, with good with a good setting, with an ambient setting, okay. Nothing should be entrusted over them, otherwise they may get agitated. In a situation of a very sympathetic feeling and in a very empathetic way, teenagers has to be counseled. In case of infertility, couple has to be counseled, not just the woman who is infertile or the man who is infertile. Couple has to be considered as a unit, and they have to be given the counseling. Explain about the reproductive system and its function in fertility, so that there is no stigma attached. Nobody will blame each other after this counseling. That is the focus here. In preconceptional counseling, parents who have certain medical disorders like cancers, AIDS, okay, recurrent losses in pregnancy, history of any genetic conditions, okay, they would require proper counseling before they before they go for their family planning. Antenatal or prenatal high risk cases, because related to counseling, related to diet, what they have to eat, how much they have to rest, immunization, precautions, medications, possible complications of their condition on their pregnancy, okay, what kind of delivery they should expect, postpartum care, all these, breastfeeding care, all this in counseling will be given. Postnatal counseling, it involves explanation about the diet you have to eat, immunization of the newborn, when and how, within which month, what immunization has to be given, importance of exclusive breastfeeding for 6 months, postpartum exercises, contraceptive options. These 4 elements have to be discussed. Family planning. Couple as a unit has to be considered here. All the available methods which suits them, which is advantages for them and disadvantages for them, everything has to be explained properly. Failure rate, every family planning method has certain degree of failure rate, okay, so that failure rate has to be discussed. What suits the particular couple for their goal, long-term, short-term goal, based on that counseling has to be given. How to use the contraception, precautions, everything has to be explained to them as well. HIV patients, risk of vertical transmission to the baby, And if it happens, what are the management options for the prevention of vertical transmission during antepartum, during the pregnancy time, during the labor or delivery time, and postnatal period. Okay, not to allow the spread of the virus from mother to the child. How and all you can prevent that has to be counseled. Surgical procedures in gynecology. Most frequently complications take place in procedures like dilatation and curettage, that is abortion, MTP, biopsy, hysterectomy, oophorectomy is removal of ovaries, okay, laparoscopy, hysteroscopy, sling surgery, tuboplasty, sterilization, these operative vaginal delivery, C-section, okay. In these all situations, you have to make sure that a written consent has been taken properly before all the surgical procedures are done. Counseling following difficulties, complications, and mishaps, timely communication about the progress with frank discussion, okay, how to avoid legal actions in large number of cases, okay, these counseling has to be given. Menopausal women, how to work their way through their menopausal phase, a lot of symptoms, a lot of changes in behavior, psychological, mental, emotional changes, physical changes, lot many changes happen in menopausal women. How to navigate through these symptoms has to be given. Next, coming to the last topic of measures to prevent any lawsuits. So first, you have to select your patients properly as per your knowledge, as per your capabilities. If it is a high risk pregnancy and you think you are not capable of guiding this pregnancy, you should allow a well-experienced staff, a well-experienced practitioner to carry on with the case or refer the case. Okay, so good counseling is important. Proper informed documentation is important here. Record keeping, good documentation, specifically when it comes to a high risk pregnancy. Documentation plays a very important role. Good record maintenance, record keeping, record maintenance will protect you from any legal suits. Multi-specialty approach is seen here when an operation is going on. Surgeon, anesthesiologist, okay, they should not be in contraindication. They should be on the same page while discussing on this about the same patient. Then referrals, regularly checking the expiry dates of medication, especially the OT medications, and make sure that you don't give expired or contraindicated medications to the patient, and referring the high risk patients to other facilities if required. Okay, do not waste your time in referral. As soon as you understand this case requires a better facility, better well-equipped facility, immediately start the referral procedure. Then auditing, internal auditing, external auditing will be helpful. Self-auditing, professional auditing will be helpful to judge yourself where you're doing the mistakes, which area you are prone to do the mistake. 3 R's has to be remembered here: recognize, respond, and resolve, which means during the doctor-patient relationship, you have to recognize which are the untreated injuries, treatment-related injury that can take place. Okay, make sure that you recognize the symptoms as early as possible and take a proper response in terms of giving the treatment options or treating the patient or referring them to someone else, and try to resolve the matter as soon as possible before it hurts the health of the mother and child. Risk management strategies which you choose should make sure that it protects you as well from legal actions. Okay, and whatever risk management strategies you take, it has to improve the condition of the mother and the child, not lead to losses. So these are some of the prevention methods of lawsuits. Many points are mentioned here. In brief, I have just discussed about the important points here. So that's all for the topic of medico-legal issues in obstetrics and gynecology.